We are home health agencies, hospice, nursing homes, assisted living, affordable housing, adult day service, PACE programs, and retirement communities. We deliver Meals on Wheels, provide care coordination, and are deeply embedded in our towns and cities, some having been in business for well over 100 years. So we're in it for the long haul because we care. Older adults are living at ground zero of the worst pandemic in a century. 80% of COVID deaths have been older adults. And we recently surpassed the tragic milestone of 200,000 deaths among adults age 65 and over. Those of us who have worked in this field know that our society has long ignored and deprioritized older adults. This pandemic has revealed this sad fact to the rest of the country, truly to the rest of the world, as they have watched our country's response to this vicious virus. We ask ourselves daily, how many of the most vulnerable Americans must die before we see meaningful relief? For 9 months, we've been shouting about the urgent need to protect the lives of older adults, how we desperately need more help around testing, PPE, staffing support, and the money to pay for it all. We are grateful for the provider relief funds Congress has appropriated. It has made a difference, but those funds are running out quickly and the virus rages. Many of our nonprofit members have been covering the enormous and unexpected costs of COVID by seeking charitable contributions, digging deep into evaporating reserves, or they are simply running on fumes. Some providers have closed, and others are at risk of not being able to continue operations. Where then will older adults get the services that they need? Since the start of this pandemic, our members have fought day in and day out to innovate and adapt to the challenges posed by COVID-19. Staff and resources have been stretched as they continue to deliver the highest standard of care to residents while battling this relentless and deadly virus. And now COVID's deadliest moment has arrived. We are in what experts say will be the worst phase of this pandemic. The virus is raging, infection rates are skyrocketing, and the pool of financial support is running low. Our leaders must wake up. Congress must deliver a new federal lifeline now. So today we're offering you a look inside how aging services are using innovation, dedication, and grit to keep people safe during the pandemic. But we can't do it alone. Everyone of every age and in every part of our society has a role to play in getting older adults and care workers through these next months. We're counting on Congress and each and every American to do their part. You know, aging services aren't just about care and services. They're about home, lifting spirits, and helping older adults live life to the fullest. Whether it's an aide visiting a private residence, or independent living communities where older adults move in and stay many years, or a nursing home delivering intimate daily care in a resident's own room. We are part of people's lives and we are their home. The pandemic has made it ever more clear how much like family care is. The research is clear that community COVID infection rates directly impact rates within congregate care settings like nursing homes. The sad truth is that surges of COVID around the country mean that many more cases will make their way into long-term care communities and more deaths are likely. Are we prepared as a nation to lose an entire generation to this pandemic? So what we do now, all of us, Congress, providers, and everyday Americans, will determine if we protect or endanger the lives of the older adults we love. I'm humbled by the dedication and care of the providers you are about to hear from, who pay thoughtful attention to the people in their communities, all while fighting a pandemic without all of the support and resources they need. I'm grateful to them and to all of you who joined us today. We can end this nightmare by taking action now to stop more preventable deaths. Now, let me introduce my colleague, Ruth Katz, Senior Vice President of Public Policy at LeadingAge. Ruth, over to you.
Thank you, Katie. A beautiful start, a really great description of what we're here for today. And we're so pleased that so many of you have chosen to join us to get this look, to open up the window and look inside aging services organizations of all kinds. So just to summarize the issues that we would like to talk about, we would like to we are encouraged by the relief bill conversations that we see going on, that we've watched going on in the last couple days, and wanted to be sure that aging services are part of the mix and are that you guys have a familiarity and a comfort with what we're talking about. So to review the things that we are hoping to see, we're hoping to see a federal fully funded testing program so that you'll hear some testing stories so that people aren't scrambling. Personal protective equipment, PPE, our providers across the continuum need access to it. We need to be sure that there are not shortages, that shortages are addressed, and that there's money to cover the cost of PPE. Support for frontline workers, the people that are actually providing the services with their hands, with their hearts, with their brains. Enhanced pay, people that are coming to work every day in these very, very tough times, getting up, coming to work, coming back again the next day to serve our consumers and residents. And an adequate supply on the housing side of service coordinators. And we'll talk more about that in a little bit. Generally preserving the long-term care system. So often now we are talking to people in what I think is really the safety net of care for older people in this country. And they're saying, I'm digging into my reserves. I don't know how much longer I can keep going like this. So what do we mean? We mean provider relief funds, paycheck protection program extensions and expansions, other funding for pandemic related costs. I have a very specific ask on the housing side because many of the members of LeadingAge are providers of housing to low-income seniors, affordable housing. We're looking for $1.2 billion in relief for those providers. They don't fall easily into the group of housing of health providers. So we wanted to call that out separately. And telehealth has become such a big piece of what we talk about in COVID time that it drives home the need to have Wi-Fi access in all buildings where older people live. And then finally, funding so that we can be sure that the very promising vaccine program, which is giving everybody a lot of hope, including aging services providers and the people they serve, that is funded and that we have good education so that people are not reluctant to pull up their sleeve and get that vaccine. So we wanted to give you guys really a real opportunity to feel what it's like and to even actually see what it's like in aging services organizations. And we have 4 of our very committed LeadingAge provider members with us today. I will introduce them all and then turn it over to them to tell you a little bit about life in their organization. Amber Talco is with us. She's a licensed practical nurse at St. Paul Elder Services in Wisconsin. Scott LaRue is the president and CEO of Arch Care in New York City. Marilyn Spalding is with us from Kentucky. She's the president and CEO of Christian Care Communities there. And Dorothy Davis is the president and CEO of the Visiting Nurse Health System in Atlanta, Georgia. You are about to hear some stories that I think are gonna knock your socks off. So with that build up, let me turn it over to Amber. Over to you, Amber.
Sorry about that. On August 25th of this year, I lost my first patient to COVID. She declined so quickly under our care. And prior to her time on our COVID unit, she was a relatively healthy, mobile, and high-functioning patient. She enjoyed a very rich life here. Her family did not want to come and see her on the COVID unit. They were afraid to see her in the condition that she was in. But they had nothing but praise to say about our care that we provided and how hard we tried to prevent that outcome. We had advanced care planning in place for each and every patient, but at the end of the day, it still was so heartbreaking to lose someone to COVID. At that moment, as I held her hand while she took her last breath, I realized that I was just so defeated and I felt so useless and angry and honestly fearful as to what was to come as our outbreak continued. I think it was the first time that COVID actually felt real to me, as I experienced a death firsthand. I realized how bad I was hurting at that point, and that was the point when I really needed support. If you fast forward to today, we've had 75 cases of COVID in our facility, and we've lost 21 patients during their time either on the COVID isolation unit or within the next following couple weeks as they return to their homes. We've had 86 staff members test positive, 56 of whom were due to internal spread in our facilities. I've been working on our COVID unit since our initial outbreak, and the stories truly are heartbreaking. We as healthcare providers are doing absolutely everything we can for our patients, but caring for COVID is extremely complex. The conditions of our patients change so suddenly, and they can be completely okay one day, and they can be deceased the next. The loss is so sudden and so unexpected that we are exhausted and we are full of grief that we don't even know how to process. We're constantly assessing our patients. We're taking their vitals multiple times per shift. We're updating doctors and we're updating families. And unfortunately, the assessments usually aren't great. It's still not enough. And I just can't even explain the loss that we're experiencing. Working on a COVID unit too, it's very isolating, not only for the patients, but also for us. We have to rely on people outside of our unit to do simple things for us, like send a fax or get us the supplies we need back on our COVID unit so that we don't spread our illness throughout the rest of the building. The thing is we can't stop COVID in our facility. I'm fortunate enough to work for a very ideal facility. We are a 5-star facility. We have been for 9 years. We've undergone 5 state infection control surveys with absolutely no deficiencies, and 1 federal survey with a minor citation that is being appealed. We test our staff here twice a week, but it's still not enough to control an airborne virus. Unfortunately, our staff and patients are facing trauma every day. We had 2 husband and wife couples on our COVID unit, one of which had dementia, and the wife would come out about every 30 minutes wondering to us what is wrong with her husband. She couldn't understand that we were doing everything that we could for him, but unfortunately, again, it wasn't enough. And to try to explain that to somebody over and over again, it literally just breaks your heart. Our other married couple, his wife unfortunately had to go to the hospital and passed away without him by her side. The husband of the first couple was one of the most prominent attorneys here in our Fox Valley with a Harvard education, and his life mattered, as did all the patients that we lost. And I think we deserve it to them, or we deserve to show them how much their lives do matter. Staff members are completely stressed. We're full of anxiety and anger, and often you just feel it bubbling beneath your skin. You're trying to hold it together every day, and it's very difficult. I've watched funeral homes come and pick up our patients that I've cared for nearly 4 years, spray their faces, their deceased faces, with disinfectant because they're so fearful of this virus, even in a deceased person, and cover them with plastic. And those are my patients who I loved being taken away from me. I have this fear, and so do many of my coworkers, of becoming apathetic and numb to this continued trauma that we're experiencing and the events that are going on. A lot of us we're worn out, we're tired. We struggle to continue to be bedside nurses, but we still show up every day because it's important to us and our patients are important to us, and we would never leave them. Healthcare professionals who are working in nursing homes are mission driven, and we make our sacrifices every day to be here for our patients. To be clear, we did not sign up to put our lives on the line. We did not sign up to get sick at work. The majority of the world's working remotely from home, or they're being paid to stay home, but we show up every day without government incentive or compensation, and that's something that we're happy to do. Our families mine too, are afraid to see us because they're afraid of an illness that we might carry and bring home to them. And frankly, I fear bringing the illness home as well to my family, to my aging grandmother. My husband, he was told by his employer to begin to work virtually because they found out that his wife was a COVID nurse and they were fearful of the spread that he might bring to the workplace. We're also adapting to change. Every day we're getting updates and emails and policy change to try to stay ahead of this virus. And it's a kind of change that we're not used to, but we're adapting every day. What we really need is for Congress to give our staff and residents the best resources to survive this crisis in a new stimulus bill. We as healthcare workers, we really need compensation and support from Congress that recognizes that we are experiencing trauma every day and that we are dealing with grueling and difficult work. The hand clapping, the social media posts, the free coffee, it's all wonderful. Please don't get me wrong, but the sacrifice that we are making really needs to be recognized. We as frontline workers are doing everything we can to protect our patients, but we need Congress to have our backs as well. We need them to provide supplies for nursing homes and give our patients the best chance possible at a positive outcome. Our patients deserve their families to be by their bedsides. We need a safe way. We need to have the PPE. We need to have a safe way to provide those visits for our families. And we also need to stop blaming nursing homes. Instead, we need to be given what we need to stop this spread.
Thank you, Amber. Thank you so much. That was very generous of you to share that. I neglected to mention, please type your questions and your comments and thoughts, everybody, into the chat box, and we will take them at the end. We very much look forward to engaging with you in that way. We'll turn it over to Scott.
Good afternoon. My name is Scott LaRue. I'm the president and CEO of ArchCare, which is the healthcare ministry for the Archdiocese of New York. We serve over 1,700 individuals in nursing homes on a daily basis. We implemented our disaster plan the third week of February of this year when we saw what was happening in Kirkland, Washington. We didn't wait for direction from the state. We didn't wait for direction from the federal government. We immediately took action. And our motto during this entire pandemic is we were going to do whatever was necessary to protect the people we serve and our care members. What we went through in the spring was primarily driven by a lack of testing and a lack of PPE. Unfortunately, decisions were made in our society about where those resources were going to go, and they were not originally given to the nursing homes, even though we knew the high risk of the people that we served. Thankfully, we do know and we do have testing and PPE at this time, and we're grateful for the funding that was provided by the initial stimulus. We took the opportunity after the first wave to reinvest in our programs, developing new infection control protocols, technology, thermal temperature scans, HEPA filters, ultraviolet lights, hired a medical director of infectious disease, put infectious preventionists in every one of our programs. We spent over $2 million in enhancing infection control protocols in anticipation of a second wave. But we also did that during the most significant financial crisis we have ever faced as a system. Since the beginning of this pandemic, we spent $4,057,000 on testing. We spent $3,276,000 on PPE. We spent $1,757,000 on traveling nurses in order to bring nurses in from other parts of the country in order to ensure that we had appropriate and safe staffing in our homes. And we did this at the same time when our revenues were down $21 million because of COVID. When elective surgeries stopped at the hospitals, the flow of patients stopped to the hospitals, and therefore stopped flowing to the nursing homes. I feel very comfortable. We've done everything we can to be prepared for this second wave. But what is most troubling is at my last board meeting, I actually had to create a slide that showed my board members how many days of cash I had on hand by program before we would have to close the program. If it wasn't for the funding and stimulus that we received so far this year, we would have lost $36 million in our nursing home operations. During this pandemic, many people discussed the racial disparities and how unfair it was to the minority communities. I operate a nursing home. All of mine are 5-star and have been in the poorest congressional district in the United States, the South Bronx. 93% of the people we serve there are minorities. Nearly 100% of the staff that work in that facility are minorities. That facility is going to lose nearly $5 million this year, and our budgeted loss for next year is $3.2 million, depending on how long the pandemic lasts. These are numbers I cannot sustain. And in the absence of additional stimulus funding, unfortunately, we're going to have to default to the chart that shows where the cash is going to be able to pool and what facilities are going to be able to survive. It is unconscionable that during a pandemic that you would have a facility in the poorest congressional district of the United States, and I do not have sufficient support to keep the doors open to that facility. So I'm thankful for what you've done, and I'm begging you to consider additional funding so that the people we serve in these communities will be able to continue to have the services that they deserve and that we offer to them in a very extraordinarily high quality manner. So we thank you for your time today, and we appreciate the opportunity to share with you the significant impact this has had on our healthcare infrastructure.
Scott, thank you. Thank you so much for your honesty and clarity in presenting that case, talking to us specifically about some of your expenses as well as the emotional experience of going through it. Let's move on to Mary Lynn. I think you're on mute, Mary Lynn.
There we go. Sorry. Good morning. Thank you for the opportunity to speak with the group. And it's humbling to follow two such amazing individuals as Amber and Scott. My story, I'm the CEO of Christian Care Communities here in Kentucky. We have been providing services in the Commonwealth for 136 years. We serve about 5,000 older adults in all levels of care. So not unlike Scott, we have skilled nursing. And then on the opposite end of the spectrum, we also provide a lot of affordable housing as well. We employ not quite 900 individuals to care for those 5,000 older adults. And I think that my story is a little bit of a blend of the two. And the reason why is that I have the blessing to look at this from the CEO perspective and to try to make good decisions in a difficult time. And then I also have the opportunity to put on a pair of scrubs and go out and work in the field. We too were very well prepared. We got ahead of things early, and we had PPE supplies that we had brought in. We've experienced since about June 3 significant outbreaks in our campuses. The first was in our Corbin community, which is in the heart of Appalachia. The second was in our Louisville campus, which is a very urban market, and we serve a very underserved population there. And then the most recent was in Hopkinsville, which is on the western side of the state. During that time, we ranged anywhere from in Corbin, 50 of our residents that were impacted with the virus, and then to Hopkinsville with nearly 85 residents that were impacted. Our buildings are 5-star buildings too. We went through infection control surveys that were deficiency free. And we continued to provide care amidst significant challenges with residents, with their families being fearful, and then also with our staff with legitimate concerns, many of which Amber's already described. But who I want to tell you about is Nancy. Nancy lives in our Louisville campus, and she doesn't live in one of our health centers. Nancy is visually impaired. She is legally blind, and she contracted the virus. She was living in our affordable housing, and she had no one to take care of her. That's the story of many of the residents of our affordable housing. Their families may not be available or have not been actively engaged. So you can imagine some of the significant challenges just to have essential supplies provided to Nancy. Nancy was pretty independent. She went to the grocery store. She could no longer do that. Nancy needed medical care. She could no longer do that because she was placed in quarantine, as she should be, to prevent the other 385 older adults that live in these apartments from contracting the virus. So our staff, our very small staff in independent living with no service coordinators, rallied around Nancy, and we adopted her. And they went in amidst fears with PPE that they borrowed from the health center to take care of Nancy. And I'm very pleased to tell you today, Nancy's doing great. And the rest of our community has gotten through that. The stories are heart-wrenching, and each one of them is just amazing. And I'll share one other brief story. This is a story of our first COVID positive that was in our Corbin campus. This was Debbie. We called her Little Debbie. She had Down syndrome. And I'm going to apologize because I have a really hard time with this one. She and her mother shared a room in our health center, and that's where they had lived. They both contracted the virus. And by the way, this is a 5-star campus with no infection control deficiencies and a great staff, but they both contracted the virus. And we had to send Debbie out because her respirations got so difficult. And then we had to tell Debbie's mom that Debbie didn't make it. The devastation that this has on someone like me that was not there every single day is minimal compared to the devastation that it has on the staff that had cared for Debbie and her mother for years in long-term care. By the way, both of these individuals are Medicaid recipients. These are the types of stories that are out there. And these are the types of staff that take care of these individuals day in and day out before COVID. They are part of their family. So just as with Nancy and with Debbie, we have become a big part of their family all along and are even more so now. I wanted to share some good news. Kentucky has been very, very unique. We got out ahead of the situation, and Kentucky has been blessed and been able to provide testing. So that allowed us to identify individuals very quickly. Every county that we operate in Kentucky is a red zone right now, which means we are testing twice a week. And the cost of that testing that Scott shared has not impacted us because it has been subsidized by the state. And we are thrilled with that because we would have not been able to cover that. And we feel very, very strongly that we were able to identify individuals early and not have additional stories like Debbie. We've recovered a huge number of folks that had COVID, but it's mainly because we caught them when they were asymptomatic. And the same thing with our staff. Unfortunately, as we come to the end of the year and the increases in staffing and the financial pressures, we're very fearful that that will no longer exist in 2021. So again, we urge continued financial support for that testing because we know that what it can mean, and we've been able to demonstrate that. Staffing and getting our staff back to work. We had deployed one of our nurses on a corporate level. She's kind of become our employee health nurse, and she has talked to every single one of our staff that has become COVID positive or has been exposed to someone. We have been able to return not quite 140 staff members back. We have 2 or 3 that are still out, but we know that we'll be getting them back to work. The other thing is that our staff are not exempt from going to the hospital. We actually had one of our nurses with some comorbidity that unfortunately contracted the virus, and she was in intensive care on a ventilator, and she has returned to work in Hopkinsville. So there's story after story that I won't take your time in sharing, but I did want to paint a picture of what we're going through, what each and every group all across the nation is going through, what testing has meant to us, the ability to get PPE and the continued ability to get PPE, and what the exhaustion means. But we will continue to fight. We will continue to fight given the provisions and the things that we need so we can keep our doors open, because we serve the least of these. That is our mission, and that's what we've continued to do as we move forward. The last thing that I wanted to bring up is one of the other challenges. And when we were preparing for this call and I was thinking about it, I looked at it as we've aggressively fought the virus. We've aggressively tried to locate resources, and as I say, been very blessed in the state of Kentucky to have access to testing, and that has helped a great deal. But the last thing that is the big concern, after all of this work that all of us have done, and all of this love and care that our caregivers have given, we're very, very concerned about professional liability. I mentioned Corbin was our first location. We have received our first medical records request, and we are so fearful because we are in a state that unfortunately has no tort reform, that the next thing that we will need to battle is frivolous lawsuits and increased cost in our professional liability. So in closing, I would just ask continued financial support for these amazing staff, as much resources we can possibly have in PPE to be able to keep people safe. The money for affordable housing, because if not, those individuals will end up in the hospital system and may not be adopted like we were able to adopt Nancy. And then the review of protecting us from liability. Thank you so much for your time, and I appreciate your attention.
Mary Lynn, thank you. That was beautiful. Thank you also for highlighting the affordable housing issues specifically. I think that's really important to hear because they are not necessarily in a healthcare environment. It's very important to think about those. Thank you for also talking about liability. It's a tough one to talk about. Our providers are working harder than ever before, and that's a really important thing we need to see in relief legislation. And I guess also thank you, and this is going to go for everybody, just for opening your heart to enable us to open our hearts to hear what's really going on and see how essential relief is. We'll turn to our last speaker now. Dorothy, over to you.
Well, thank you, everybody. It's an honor to be here with you today and to follow the three speakers. I'm Dorothy Davis. I'm the CEO of Visiting Nurse Health System in Atlanta, Georgia. We're a 74-year not-for-profit that has been focused on taking care of folks at home. Our history has been, we've done many things over the years as the needs of our community and as the Medicaid and Medicare became evolved, but who we are today is a home health, hospice, palliative care, Medicaid waiver, and private duty health system. So we take care of all of our current 6,000 patients in their home over in the metro area, but also we serve some rural counties. So I want to make sure we have a perspective both of being in a large metro area, but also serving the northern and southern portion of our state in the rural counties. A couple of things that I think are important. Sounds like I'm having, hopefully my internet is that any better? Yeah? Okay, thanks. So one of the things for our experience with COVID has, we were prepared, and I will say prepared as anyone could be prepared. We were prepared on the PPE to the best of our ability, but one of the stories that I tell frequently is pre-COVID and COVID experiences from a PPE. We used about 6 gowns a month, and that moved from 6 gowns to approximately 500 gowns a week, just for perspective. So it's not simply the PPE access, but it's just the change in infection control And I will say in across our entire health system, we have maintained, even in March and April when our visits at home did go down, but our average visits this year, when I look at our average, is about 2,500 visits a week. So I think the perspective that visiting nurse brings is how important keeping folks safely at home is, and how hard it is to do when we are doing our nurses, our therapists, our certified nursing assistants, our social workers, our nurse practitioners, our doctors are going into homes and congregate settings and assisted living settings and skilled nursing settings, and it is an uncontrolled environment. So infection control became very different with COVID because we're walking in each and every time to uncontrolled environments. Of course, the workforce challenge is something I'll speak to in a minute, but over the course of this disease, we've had over 500 COVID positive patients that we care for. I am certain the number of COVID positive folks we care for is more than that, but these are known positive infections that we have been responsible for providing healthcare at home. A significant portion of these infections with our patients are through our Medicaid waiver program, and these are individuals that are the hardest hit, and individuals with health access issues, individuals with health literacy issues, and what our staff is doing is supporting them to understand the guidance, to remain safe, and to ensure that they can stay safely at home. Now, our organization experienced COVID very personally early on. Our first loss was an employee back in March. This was before we had a patient with known COVID die under our care. So we lost a long-term employee after a 2-week hospitalization in March. So it has become very personal for our organization. Really addressing the fear was and has, it continues to be an important part of education to our staff. Because we are in uncontrolled environments, PPE has become the lifeline for us early on. We have, I have a story I've shared a couple of times where right after Georgia opened back up, we were within 2 days of running out of gowns. And it was really through having government relations contacts through our organization that we were able to secure some additional gowns. So we never said no to a patient. And that was our operational commitment from the beginning, to never say no to a patient at home, because we wanted to keep our seniors safely at home with the care that we could provide. So one of our asks is coordinated strategy for PPE, for testing, for vaccines, because it has not been coordinated at a state level for PPE. Our goal is 90 days of PPE on hand, and we are 90 days on all items except masks. We have N95 masks, but we do not have sufficient masks, and we are sourcing daily for PPE, and we have paid a lot of additional money. And what I will say, as a smaller provider, not being a hospital, home health in particular, which has been such an essential part to support patients coming out of hospital settings, coming out of nursing home settings, patients in HUD high rises and assisted living, we are a critical part of supporting seniors staying safely at home with healthcare. So to not have a coordinated strategy on PPE has put an enormous burden not only for a small provider like Visiting Nurse. I consider a small compared to a hospital. And we are just now in the last 30 to 45 days being asked to tell our story as a home health provider. So I want to say home health is a very small portion of healthcare spend, but today is a critical part of supporting our seniors at home. Also testing, I will say we have been fortunate to receive testing, but I consider us just lucky. Do we want to depend on luck to support our seniors, or do we want to have a coordinated federal response? I would ask that we have a coordinated federal response. We do not have that. We have luck, and I would say Visiting Nurse has been very lucky. Again, a part of our commitment as an organization and as a provider to work with LeadingAge, we have been the recipient of Bionex tests. We test staff weekly. We test patients. We are working currently with adult day health providers and the personal care home networks in Georgia that have some of our greatest risk clients and patients and do not have access, and we're testing folks. There is such a need. We will go through those Bionex tests probably within the next 10 days. But again, one of our asks from our view and perspective is coordinated PPE strategy and a coordinated testing strategy. And I would like for Visiting Nurse to be a part of the vaccine strategy. There are a lot of logistics that need to be discussed and thought through, but we want to keep folks in congregate settings and places safe, and vaccine is a part of it. I also will say and speak to for a minute the workforce pressures, which are enormous. I hear that among all of us. Amber, I hear your tiredness. Every single one of my staff speaks to this. I share this. This is a 7-day-a-week job. This is not a 5-day-a-week job. This is decisions. There is not a decision that anyone in our field makes without having to think through our personal lives, our children, our own health, our own risk, our own parents. And so we're tired. For me, what that means is knowing that the pressure that will continue until we really have a federal response. We are going to have nurses choose to quit because they're just too tired. We also have many single mothers who are balancing kids at home. And I want to just talk about that for a minute, and the education coordination, the lack of a coordinated federal education strategy is an important piece that we experience, particularly in Georgia and in the metro area, where unless you are in private schools, folks are at home, kids are at home. And that also has a whole nother level of stress in addition to the health concerns that our staff feel. So one of my messages today is it's important that we do have a federal response. Like I said, we've been very lucky. We've paid to be lucky in some cases. We have been very fortunate because we are a not-for-profit and we do have a tremendous amount of goodwill and support here in our area, and we've leveraged that for the good of our organization, for our patients, and for our employees. But I think about all the providers, the smaller providers that are essential in our network to support our seniors. They are not so lucky. And so I really appreciate the opportunity to share our story and appreciate LeadingAge putting this forum together. So thank you.
Thank you so much, Dorothy. Home health is a very important piece of the aging services continuum. Older people move throughout the continuum all the time and use a lot of different services. Janine, do we have some questions?
Yes, we do. I'm going to start over, Mary Lynn. We have a question for you focusing around housing. Can you discuss about service coordinators? Do you have a service coordinator in each of your buildings?
We have service coordinators in a number of our buildings, but not every single building, just because of some of the funding constraints associated with that. The service coordinator's role in the example that I gave for Nancy has to be somewhat limited just because of the resources that are out there. But now with the pandemic, in addition to all the complications, we really need some more support in that area because it is a lot more time consuming. Secondarily, having Wi-Fi access in our buildings will help because as what I described with Nancy, a doctor's appointment, which sounds like a simple thing, has become quite complex. And obviously, when she became COVID positive, the physician's offices did not really want her in there. Plus, we didn't want her going out because of her quarantine. So telehealth would have helped.
Thank you. Thanks, Marilyn. Sky, I have a question for you. When you're looking and working with your staff, can you kind of give us a little bit of an overview of the challenges that you've had with any sort of well-being and talk about a little about the mental health of staff and what you might be doing and what we could advocate for in the future?
Yeah, sure, absolutely. We've been conducting regular surveys and dialogue with our care members. We have 4,000 employees across the system. And what was most shocking to me was when we asked the question about the need for mental health services and support, the number of people who responded and actually put their name on the anonymous survey and said, please have someone reach out to me. I mean, normally people are very tight to the vest when they need mental health services and don't want to seek the assistance. But we actually had people saying to us, help me, directly, here's my name and number. We put a bereavement counselor in the system to help the staff cope with the loss of the residents that they had cared for many years. We've provided counseling in-house for care members who have passed and those that worked with them. And then we also provided external mental health resources for the staff that weren't comfortable using in-house support groups. I've never been to a war. I don't want to make a comparison. I have no idea, but the staff is definitely traumatized by what they went through. And, there's a definite, I can't believe we're going through this again, that this is happening again. And I'm very concerned. And the other part of the survey that was shocking to me was 25% of our staff said that they had food security issues. And our staff are well compensated, but many of them might have had 2 or 3 jobs and they've lost the other 2 or their spouse. I even had a nurse that, making 125 grand said to me, all my kids moved back home. They're living in my house. My utility bills are up. My food bills are up. I have to work overtime to make the bills to meet the needs. At Thanksgiving, we had an anonymous opportunity for people to come get food certificates. We gave out $50 food certificates. 1,613 staff came in and said, I need help in order to put food on the table for Thanksgiving. So the impact that this has had on our staff, both mentally, economically, is immense. And, we took the position just as we did with the expense on the infection control. I can't have someone working for Arch Care going hungry. And if it means we're going to spend our last dollar making sure we protect the people we serve and the people who work for Arch Care, that's what we're going to do. And eventually, that's where it comes to additional stimulus funding and support. All of these things cost money. And at the same time, you've got an infrastructure that you're attempting to sustain that is got census that is at least 20% below historical levels. So it's had an enormous impact on the staff.
Thank you, Scott. Thank you for giving the experiences and exactly what's going on in your organization. I'm going to come over to Amber. We have a question. Amber, thinking about the challenges that you've gone through in the last few months in the pandemic, just sort of globally, what are you worried about heading into the winter in your organization and from your perspective?
As a nurse, I think I'm worried about noticing the difference between the flu and COVID and realizing that we are going to be dealing with a lot of other illnesses besides COVID, and COVID is already so burdensome that we're going to be throwing all these other illnesses in with it, and it's going to be more testing for our patients, whether it's influenza swabs or COVID swabs, and I feel like it's going to be really tolling on us and our patients.
Right. Thank you. And a question over to Dorothy coming in about telehealth. Can you tell us a little bit about in your organization how telehealth was able to help with any patient safety issues or anything with your staffing?
So yeah, we were very excited about the relief CMS provided on telehealth. We certainly benefited by being able to stay connected in those new ways. Of course, for our home health, we have not been reimbursed for telehealth. So I would say that's really an area of policy and an area to further consider from a federal perspective. And I think that's a real missing component for in the kind of relief that we gained. Hospice, I think, was with hospice as well as with our Medicaid waiver, we saw tremendous relief, and that became very impactful in our ability to stay connected with staff. I do want to just make a plug about wireless and Wi-Fi, particularly in senior living settings. It's always surprising to people right in the middle of Atlanta, Georgia. Many of our HUD high rises, we have no connectivity. And so we encounter just the ability of being able to document point of care because of connectivity. So, you know, obviously, if I was a senior housing provider, not having, you know, there are many other elements to consider from a policy perspective, but I do think that we did experience Wi-Fi issues, and of course, just the ability to connect with seniors. There's just a lot of learning and training. But one thing I do want to say specific to some of the relief we saw, just want to make sure that there's federal relief, but that doesn't always filter down at the state level. So want to make sure that, you know, it was one of those things I talk a lot about the Practice Act in each state. So for instance, Georgia has not adopted a lot of the, you know, relief that came from CMS because the state has not either, I don't know if it's neglect or if it's choice or if it's politics related to, you know, different groups. But for instance, orders for home health, we still have to have a physician sign the order. That was a relief that came in April. Has not made it down into our state manual. So from a regulatory, from a compliance perspective, we still are not feeling that relief in Georgia.
Great. Thank you, Dorothy. And I want to say thank you to Scott and Amber and Mary Lynn. Thank you for being here today. Thank you for answering our questions also that came in. I'm going to turn it back over to Ruth to close out.
Okay, thank you, Janine. Yeah, I just want to wrap up and say, you just heard from 4 people, committed, high-performing, really extraordinary people who go to work every day and fight a life and death battle with COVID. They're not just inconvenienced by it, they're fighting every day. And there are more than 5,000 provider organizations that are members of LeadingAge across America. And when you think about the number of individuals we're talking about that are doing this job, that are going to work 7 days a week, We're talking about millions of people. So these are just 4 stories that we've been able to share with you today. You heard the desperation. You saw the picture, as Mary Lynn said, you saw that picture painted so clearly. Dorothy talked about PPE, unprecedented PPE needs and spending for them. It's one of the main things that we're looking for in relief legislation, supply of them, things like masks. They've got to be available, and we've got to have the money to buy them. And we're talking about now. We're not talking about January. We're talking about January too, but we're also talking about now. You heard Mary Lynn talk about how testing is available in Kentucky. What a blessing that is, that Kentucky chose to use their CARES funds. But what about New York? What about Wisconsin? This cannot be a state by state. Some states will test, some states won't. Some states will cover it, some states won't. You heard Scott talk about what he's been spending out of pocket for testing. We need a federal program, a fully funded federal program. You heard about relief funds, and Scott talked about the possible loss of a nursing home in the poorest place in the state of New York. You can only operate organizations at a loss for so long. And this is the American aging service system that we need to preserve. This is what we're talking about. Did you pick up the staff fatigue? I'm pretty sure you picked that up. And did you also side by side pick up with that the depth of commitment that these human beings are telling you about, that they're talking to you about? Amber, who really does this 7 days a week, who can't see her own family, who's giving up seeing her own family, whose husband has told you better stay home from work because of your wife's job. That story is repeated millions of times daily across millions of workers. As Amber said, we are the people that are taking this on. And as she also said, we appreciate the free coffee. Keep it coming. But think about this, you know, people need to be thanked and properly reimbursed for this. And folks who work in Congress, members of Congress, you hold in your hand the key to getting Amber and her colleagues the pay that they deserve for the hard work and the sacrifices that they're making. Thank you for considering LeadingAge's asks and our desperate request for relief action now, as soon as possible. Please work this out. As Dorothy said, we need a coordinated federal response. You can help us make that happen. You can make that happen. For all the Debbies, for all the Nancys across the nation, we need a coordinated federal response. Again, I want to thank our speakers, Scott, Amber, Dorothy, Mary Lynn. I want to thank all of you for joining us today and taking the time to hear about life out across the country. And please, again, we're asking the impossible because every day our members are doing the impossible and fighting this battle. Thank you. Thank you for your time.